how India and the rest of the world are fighting this battle against COVID-19 pandemic. Now, the most important aspect in this battle against COVID-19 is that we have to figure out a cure for this particular disease. Now, there is research going on. Scientists, researchers across the world are at work for almost 6 months now to try and find a possible solution to this pandemic. And there are different drugs which are being talked about and trials going on. One such drug is Dexamethasone, about which a trial known as a recovery trial has been conducted by some scientists and researchers in United Kingdom. We have with us a distinguished panel of guests today, and we're going to talk about this particular drug, that is Dexamethasone, and the recovery trials as well. What does it do and how does it help in the fight against COVID-19? So let me first introduce the guest to you, beginning with, we have Professor Peter Horby. He is the Professor of Emerging Infectious Diseases and Global Health from the University of Oxford, and the person who have been involved in recovery trials on this particular drug as well. We're also joined in by Dr. Archisman Mahapatra. He is a well-known epidemiologist, and Dr. Ram Vishwakarma. He is the director of CSIR's Indian Institute of Integrative Medicine. Welcome, all of you gentlemen, to Rajya Sabha TV. And let me first begin the show straight away with Professor Horby. And Professor Horby, let's try and understand more about this drug, that is Dexamethasone, and the recovery trials.
Yeah, thank you very much, Vijay. Well, the recovery trial is a national trial in the United Kingdom. So it's been set up under the National Health Service, and it's open in more than 170 hospitals across the United Kingdom. We started recruiting patients on the 19th of March, and it's a randomized controlled trial. So patients will be offered the chance to be in the trial, and if they accept, they will be randomly allocated to some different drugs or just to their usual standard of care, so that we have the same sort of patients in each group and we can directly compare the outcomes. One of the drugs that we've been studying is Dexamethasone. We've been studying 5 others. So far, we've had results for 2. We had results for hydroxychloroquine about 2 or 3 weeks ago, and now we have results for Dexamethasone. The trial has now enrolled more than 11,500 patients, so it's very big. And we enroll patients in a ratio of 2 to 1. So we have 2 people on standard of care versus 1 on the active treatment. So we gave Dexamethasone to just over 2,000 patients with COVID, lab-confirmed COVID, and compared them with about 4,000 randomly allocated controls who just received standard of care. And what we saw was quite surprising, actually. We thought Dexamethasone may have some effect because the disease, as we will discuss later, has an inflammation component. But what we saw was a really clear benefit in some patients. And I think the some patients part is very important. What we saw was that in patients who required oxygen on the ward, we saw about a 20%, a 1/5 reduction in the risk of death within 28 days. But in patients who were on mechanical ventilation, so they had a breathing tube and assistance, we saw about a 35% reduction in the risk of death, which was quite amazing, quite surprised us. Mm-hmm. But in patients who were on the ward not requiring any oxygen, we did not see a benefit. In fact, there may even be a harm. So I think it's very important to get the drug to the right kind of patients.
Okay. And why focus on Dexamethasone in addition to hydroxychloroquine and 3 other drugs which you're saying, because recovery trial is focusing on 5 drugs. So if we are talking about Dexamethasone right now, why bring Dexamethasone in the picture here?
So the disease seems to have 2 elements to it. One is it's a virus infection, and particularly early in the disease, you're seeing replication of the virus, and it's replicating in the lungs. And so one class of drug is the antiviral drug, and we're testing some antiviral drugs, which includes hydroxychloroquine, also lopinavir, ritonavir, an HIV drug, but also we're looking at convalescent plasma from recovered patients. But patients who progress to severe disease, they also then get lung inflammation as a result of the viral infection. And so Dexamethasone is an anti-inflammatory drug. And so that's targeting the excessive inflammation in the lungs, which is really what leads people to get very sick, and most of the patients die from respiratory failure.
Okay, so that's the focus out there, to try and bring down the inflammation as far as lungs is concerned, because the respiratory system is one of the parts of the body where this virus attacks. Let's bring in Dr. Ram Vishwakarma here. Dr. Vishwakarma, your views on the recovery trial and the points which have been brought in by Professor Horby here in terms of the kind of results which dexamethasone has shown in these trials. Is that enough for us to start being hopeful about the fact that dexamethasone might be really, really useful here?
Yeah, so to me, this is the best news so far since the virus started. And I'm very happy that this group of Dr. Hobby just published this paper today. So I think in the spirit of science, all the data, in fact, today I enjoyed reading this manuscript which came as a preprint, as a phenomenal work. I don't think trial of this power has been done on this disease. We have been struggling with multiple trials with antivirals, and in India as well as in US, and all kinds of controversy. This is unequivocal, highly powered RCT that has come along, and come along with the best news that I could have as a scientist and a person who could get infected by this disease. Is the best news that I see. And second thing, I would say that this is a drug which has been at the center of metabolism and inflammation for almost now 60, 70 years. And in fact, our bodies are protected by this drug endogenously, because this is a class of molecule we call steroid, which are very critical for our survival. And I think this dexamethasone sits at the center of that trans-activation and trans-repression mechanism, as Dr. Hobby very nicely described, that there are two components to this disease. So first week, when you have viral replication happening, this drug may not be that effective. The moment you enter into second week, when you inflammatory thing that is doing the most organ damage, lung damage, and all kinds of infarctions in lung. Yesterday I was discussing with a British scientist. He was showing some amazing data on biopsies of these patients, how much damage has been done on the lung. And I think this is something, this molecule, which is cheapest drug available to me, other than maybe aspirin, and very minimal dose of 6 milligram OD per day for 6 to 7 days. And it brings down 30% to 35% death rate on one scale, particularly people who are really terminal people, who are ICU ventilators, and then people who are on oxygen support. And imagine a country like India, this is a big news for me, actually. We are really relieved that, there is something which has solidly come. So this is the first solid scientific medical breakthrough that we have got. This is how I'm looking at this trial. So I must congratulate the whole team which actually put this. It's a large team, 126, 130 NHS hospital, very large trial, and I'm sure it's a very well controlled trial.
Okay, definitely. It has been done at a very large scale, and that's why the significance as well, and the drug itself. Let's bring in Dr. Archishman here as well. Dr. Archishman, you've been patiently listening to what Professor Horby and Dr. Vishwakarma has to say. So how would you view this particular development at this stage, specifically when we are in the middle of this battle against COVID-19? In India specifically, the numbers are rising at a very rapid, alarming rate.
Firstly, I must congratulate Dr. Horby's team. And this is a wonderful news that has come in. I on a very daily basis, get these kind of queries that when would a new drug or a new vaccine come up? So, and I tend to explain that discovering something will take time. And if we could find something that already exists and repurpose it, that will be very useful. And the good news is that here we have found a drug which is very commonly used by clinicians. So we have good experience across the country of using the drug. And it's cheap. It's already available in the market. So these kind of, and more importantly, it reduces mortality. So death rates would come down. So COVID-19 is actually creating this kind of anxiety because of its deaths. So initial countries that got afflicted had very high death rates. So with this therapy, if the death rates could come down, And of course, it comes with some kind of rider that, okay, dexamethasone could be having some side effects, but then our doctors know of these conditions and they can take care.
Okay. We'll bring Professor Horby here on that particular aspect, which Dr. Mohapatra pointed out. But before that, Professor Horby, you spoke about how effective this might be in terms of how does it work, but in terms of its effectiveness as a researcher, as a member of the team which was involved in these trials, are you satisfied with the kind of results this trial has shown, or what's the road ahead for this particular drug from here onwards?
Thank you. There's two issues really. I mean, we had 6 drugs in this trial, and of all of them, this is the one that I'm most pleased works, because as we've heard, it's available globally and it's very cheap. It's in the pharmacies, and we know the side effect profile very well. It does have side effects and we know what they are, so we can manage them. So I'm really excited about that. I think the very important message though, is that it doesn't work in mild disease. So this is not a drug to be used in the community. People shouldn't be going to the pharmacy and buying it themselves. This is for patients in hospital on oxygen, and that's where it works. And the effect is pretty good. 20% reduction if you're on oxygen and 35% if you're ventilated, but that still leaves 80%, left in those on oxygen, and there's still 65% in those on a ventilator. So there's still a way to go. I think it's a fantastic foundation, and now we can build on that. By adding other drugs. And I think what may well work best is a combination of an antiviral drug and an anti-inflammatory drug. And so there's still a lot of work to do. And I think it's really important that we have these big trials, and I think in fact, India is in a fantastic position to do large trials because that's where you get very definitive evidence.
Okay. And the point which Dr. Mohapatra brought in about in terms of the side effects as far as dexamethasone is concerned, is that something to be worried about, or as you pointed out, it's not for mild cases, should not be used in communities at large? That should take care of this particular worry.
Well, people who get very sick with COVID are often older, and they have pre-existing conditions, and one particular condition is diabetes, and we know that giving steroids can make the control of blood sugar harder, etc. So you'd need to be more careful with monitoring blood sugar, for example, in patients with diabetes. But as long as people are aware of that and the doctors are aware of that, then we can manage that complication.
Okay, and how's United Kingdom going ahead as far as utilizing this drug dexamethasone is concerned, or perhaps another trial there, or as you were saying that using this drug in association with other drugs is the way ahead, or is the final solution?
So we need to continue doing this. So in the UK, dexamethasone has now become standard of care for COVID patients who require oxygen or ventilation. And so now we can study adding new drugs on top of that. So all new patients in the recovery trial will have dexamethasone if they're on oxygen. And then we can see if adding an antiviral on top of that, or convalescent plasma we're looking at, can even further improve the survival rates. Okay. I mean, what we've shown is that you can reduce, it's a new disease, a new virus. And so I think it's great news that we've shown you can reduce the fatality rate. And it gives us hope that with better interventions, better targeted interventions and combinations of drugs, we can have a really big impact.
Okay, that's what the focus there is, as all of you are pointing out, bring down the fatality rates, because this is what, the death rates is something which is creating that anxiety among the general public, and that big COVID scare, which obviously not all of it is uncalled for, and there are drugs being worked upon. Well, let me bring in Dr. Vishwakarma again here. Dr. Vishwakarma, if you, put this drug in the Indian context, and as Professor Horby was saying, that India is well placed to go ahead and have large trials or trials at a large scale, like the one they conducted for drugs like these. How would you see dexamethasone in an Indian scenario, because we are definitely in a situation where we would need some sort of this kind of medicine or a combination of drugs?
Yeah, so this is we had discussion about this. We are doing a trial with the heat inactivated Mycobacterium W, basically to boost the Th1 component of innate immunity. So, and we were planning to do 3 trials with combination with antiviral and anti-inflammatory. Mm-hmm. And top of the line, the drug that I had in mind was the colchicine, which is a IL-6 inflammasome inhibitor, and those trials are all ready to go. Now I think I will add this arm as well. Immediately you will hear that maybe in a couple of weeks' time that CSIR will take initiative and put this, because this is something missing puzzle I see in management of this virus. This is one sudden help, I would say providential help, thanks to Oxford University in a field center, these many hospitals, that it gave some breathing space for us now to manage this virus. And 3 ways. One is this, making this basically controlling the overt expression of the immune system, because it's not the virus which is killing people, it's the immune system which is killing people. Mm-hmm. This has come the right space. Now, before that, we have other modalities through which there are antibodies, there are 6 antibodies, there are small molecules, and there are a couple of other molecules which are in trials. So I think we have now a scenario where perhaps a prophylactic approach combined with an antiviral approach, and finally having a control over the inflammation, overt inflammation, which is doing maximum damage, multi or beyond lung. The damage that is happening now I can put in perspective the virus going into brain and causing all kinds of problems. And the tissue damage is so overt in terms of multi-organs, right up to kidney, heart, liver, and all these conditions. So I think we have a very important central point now with the virus biology and pathology, because we are also looking at the beyond virus replication. From our side, we are looking at how virus synthesize and linked O-link glycan machinery, which de novo synthesizes when it goes to our own cells. And I think that's a point which gives us the opportunity to slow down before it even goes to replication stage. Right, the entry, biosynthesis, and replication. So I think this is a juxtaposing nicely with the other approaches. So I see, first I feel confident that we will be able to therapeutically manage, because I told you last time, I'm not too sure about vaccines. It has been 40 years, we are still struggling to get vaccine for HIV and other viruses. So I'm not too sure. So I think this is something has come in a really right time. And the good thing with this study is that this is unequivocal, I will use this word, which is amazing. And also, I respect the team that they put out the result immediately after announcement for the whole world to see. So you can have that manuscript and read it with all the data. So I think that is something a best way to carry out, rather than creating a suspicion when the first drug was approved. Remember that it took almost 1 month for the whole world discussing about what this is about, like a Pandora's box. This is science moves forward with the open source, providing information. And I tell you, in India, Indian doctors are the best adept to use steroids. Indian doctors are more confident using steroids in our situation. They save millions and millions of lives. Maybe Western doctors are a little bit more finicky about using steroid in different situations. But for Indian doctors, this is the lifeline. Dexamethasone, prednisolone. These are routinely drugs that are used in saving lives in our system. So I think for India, it is actually the best that could have happened.
Okay. Professor Hobby seems to be nodding in agreement there on that view of yours, Dr. Vishwakarma. So Professor Hobby, your views on the Indian context as far as dexamethasone is concerned?
Well, it's very interesting what Dr. Vishwakarma was saying. We had a lot of resistance to studying dexamethasone from doctors in the UK. It's an old drug and people think it's old and boring and they want to use new, fancy, expensive experimental drugs. And so we actually received letters from very high profile doctors, with letters in front of their name as well as at the end, sir, whatever, saying you shouldn't do this. It's, we're moving away from steroids, it's old fashioned. And so, I'm really pleased with the result that, a simple drug that targets the right stage of illness in the patient can have an effect, and it can be something that can be used everywhere. And I'm really pleased to hear that people will be using it in India, as long as they stick to the right patients, the sick ones.
Okay, that is definitely something which the people who will be conducting the test, as Dr. Vishwakarma pointed out, they'll be taking it up perhaps in the next few days with a planned strategy out there. Dr. Mahapatra, your views as far as this idea which Dr. Vishwakarma is talking about, and earlier Professor Horby also spoke about a comprehensive approach as far as treatment of COVID-19 is concerned, and a combination of drugs as well. We might get the vaccine, perhaps in 6 months, perhaps in 1 year, 2 year, whatever the timeline is. But till then, we will have to continue, fighting this virus with drugs.
Yes. So where India can really contribute is if we could have integration of data. So we have a huge number of patients. I was looking at the ministry figures, and it is something like 183,000 positive cases, active cases at the moment. So treatment and everything is ongoing for most of them. So if we could just produce descriptive statistics, what is the profile of these patients, how they are performing in our hospitals, what has been their course, what has been the treatment, what has been the side effect profile, all that stuff. So even that can be a huge data to work on, and that will produce very contextualized information. And to add to it, if we have these kind of drugs which can be used very readily in the most severely affected patients, then that itself is ready-made data for us to work on.
Okay, definitely. Data management and integration is one aspect of it, because that is what you require when you do trials. Final concluding comments from you, Professor Horby, in terms of summing up the way these trials went, and you spoke a bit about how dexamethasone in the initial stages the use was opposed, but then after the results have come in, and with these positive results, what kind of viewpoint would you put across to others, be it researchers, scientists, or even the general public at large, as far as this battle against COVID-19 pandemic is concerned? We're not so helpless after all.
No, we're not. And I think what I would like to say to people in all countries really is that, when we have a new disease, we don't know what drugs work. And instead of using things that are in front of you and just, hearing that this might work, that might work, and give it in a trial. And then you'll know very quickly. I mean, we've had millions of cases internationally by now. We could have answered this question on every drug by now if the patients were receiving these drugs in trials. So it's good for the patients and it's good for the doctors that, getting proper evidence really matters.
Okay, so it's all about proper evidence, ensuring that the trials are conducted in a structured manner so that the results are there. And if the results are positive, obviously the drug can be further worked upon. Dr. Vishwakarma, your concluding comments before we bring this show to an end?
Yeah, one short point that I can tell you, one cycle of treatment in India by this drug will not cost even 10 rupees. I'm telling you this cost. This is so cheap in India that every poor person will be able to afford it. That's number one point. The second point I want to make as a scientist, that in the history of medicine, the first revolution happened through steroids. And these same steroids are coming back, helping us in this very crisis period. So I always believe as a scientist, a drug is never old. You just have to discover its property through new science. I think this is the classical best example of that a molecule is never old. A molecule as old as I think this is the one molecule science understands best. We know every bit of it, the biology and the chemistry, and the foundation of the biology actually is based on this class of molecule, the way we understand biology. So I think as a scientist, it's fascinating to see that this molecule is coming back and helping humanity once again.
Okay, so there it is. More and more we study the virus, more and more we do our trials, we do our research, we understand not only the virus, but we also understand how to go ahead and fight this particular disease with drugs, with combinations. Thank you so much, Dr. Vishwakarma, Dr. Mahapatra, and most of all, Professor Peter Horby, and your team as well. Once again, congratulations from all of us here in India for conducting those successful trials, the recovery trials, specifically with respect to dexamethasone. And we hope to see more positive such work and result from you there as well. Once again, for our viewers, to sum it up, there it is, all about dexamethasone, the drug which has been tested under recovery trials by the the team in University of Oxford. It has given positive results, but it will have to be used as a combination of medicine and a word of advice coming in from Dr. Horby out there. It is not for use for mild patients. There will be more work being done on this particular medicine, but most important aspect is that it is very cost effective, easily available, and it can be further worked upon to provide us answers to this riddle known as COVID-19.